Common vitamin and mineral deficiencies and their related diseases. Calcium deficiency. Calcium is important for bone health and muscle function. A deficiency can lead to osteoporosis, which is a condition that causes bones to become brittle and weak. Chromium deficiency. Chromium is important for glucose metabolism. A deficiency can cause impaired glucose tolerance, which can lead to type 2 diabetes. Copper deficiency. Copper is important for iron metabolism and the formation of connective tissue. A deficiency can cause anemia, bone abnormalities, and neurological symptoms such as weakness and numbness. Fluoride deficiency. Fluoride is important for dental health and bone strength. A deficiency can cause dental cavities and weakened bones. Folate, vitamin B9, deficiency. Folate is important for DNA synthesis and cell division. A deficiency can cause megaloblastic anemia, a type of anemia in which the red blood cells are larger than normal and are not able to carry enough oxygen to the tissues. It can also lead to birth defects in babies, such as neural tube defects. Iodine deficiency. Iodine is important for thyroid hormone synthesis. A deficiency can cause goiter, which is an enlargement of the thyroid gland, and mental retardation in children. Iron deficiency. Iron is important for hemoglobin synthesis and oxygen transport. A deficiency can cause anemia, a condition in which there are not enough red blood cells to carry oxygen to the tissues. Magnesium deficiency. Magnesium is important for muscle and nerve function, bone health, and heart health. A deficiency can cause muscle weakness and cramps, heart arrhythmias, and osteoporosis. Manganese deficiency. Manganese is important for skeletal development and glucose metabolism. A deficiency can cause skeletal abnormalities, impaired growth and development, and impaired glucose tolerance. Niacin, vitamin B3, deficiency. Niacin is important for energy metabolism and DNA repair. A deficiency can cause pellagra, a condition characterized by skin rash, diarrhea, and dementia. Phosphorus deficiency. Phosphorus is important for bone and muscle health, as well as energy metabolism. A deficiency can cause bone and muscle weakness, loss of appetite, and anemia. Potassium deficiency. Potassium is important for muscle and nerve function, heart health, and fluid balance. A deficiency can cause muscle weakness and cramps, irregular heartbeat, and fatigue. Pyridoxine, vitamin B6, deficiency. Pyridoxine is important for protein metabolism and neurotransmitter synthesis. A deficiency can cause anemia, skin problems, and neurological symptoms such as depression and confusion. Riboflavin, vitamin B2, deficiency. Riboflavin is important for energy metabolism and antioxidant defense. A deficiency can cause skin disorders, anemia, and eye problems such as cataracts. Selenium deficiency. Selenium is important for immune function and antioxidant defense. A deficiency can cause muscle weakness, impaired immune function, and an increased risk of some types of cancer. Thiamine, vitamin B1, deficiency. Thiamine is important for energy metabolism and nerve function. A deficiency can cause beriberi, a condition that affects the nervous system and can lead to muscle weakness, nerve damage, and cardiovascular problems. Vitamin A deficiency. Vitamin A is important for vision, immune function, and cell growth and differentiation. A deficiency can cause night blindness, dry eyes, skin, and hair, and an increased risk of infections. Vitamin B12 deficiency. Vitamin B12 is important for DNA synthesis and nerve function. A deficiency can cause pernicious anemia, weakness, fatigue, tingling in hands and feet. Vitamin C deficiency. Vitamin C is important for immune function, collagen synthesis, and antioxidant defense. A deficiency can cause scurvy, a condition characterized by weakness, anemia, skin problems, and impaired wound healing. Vitamin D deficiency. Vitamin D is important for bone health, immune function, and cell growth and differentiation. A deficiency can cause rickets in children, a condition characterized by softening and weakening of the bones, and osteomalacia in adults, a condition in which the bones become weak and brittle. Vitamin E deficiency. Vitamin E is important for antioxidant defense and cell membrane stability. A deficiency can cause neurological symptoms such as muscle weakness and impaired balance, as well as an increased risk of infections. Zinc deficiency. Zinc is important for immune function, wound healing, and DNA synthesis. A deficiency can cause growth retardation, impaired immune function, and skin disorders such as acne and eczema. It's important to note that these deficiencies and related diseases can vary in severity depending on the level of deficiency, individual factors such as age and overall health, and other environmental factors. If you suspect that you may have a deficiency, it's always a good idea to consult with a healthcare provider who can help assess your needs and recommend appropriate supplementation or dietary changes.